All right, good afternoon, everyone. This is UMACO TV. My name is Kemal Erkan. I'm actually here today with Anthony Anuglu. Anthony is one of our directors. He is in charge of the contracting. He actually has joined some of our other sessions. Anthony, how are you doing?
Yeah, I'm good. How are you doing, Kemal?
Good. Today, we are going to discuss some of the healthcare-related issues, and then we'll start with tort reform, medical malpractice tort reform. So many people don't probably understand what this is, and it may be it may not make sense for many of you, but I'm sure those who are in medicine, they understand what malpractice is and how costly malpractice is. In fact, in United States, as we are one of the few countries in the world where physicians can be responsible for punitive damages. This is important because punitive means that even though it's not, you are not at fault, you are still responsible for the damages, and also the financial damage can be really high for those practitioners. So now what we know about the medical malpractice and having any type of damage or like being able to actually get anything from any of the injuries. The system is designed in a way that we want these things to, our legal system in the United States is designed in a way that these things should not go to a jury trial. So they're trying to get these things before it goes to the jury. Why? Is because it's timely, how time consuming it is, and also the efforts and the resources are being spent. So now there are four main elements of any of the malpractice cases. So these are professional duty owed to the patient, breach of such duty, like there has to be a breach. So you have to show that person didn't do what they're supposed to be doing. Injury caused by the breach. So this injury needs to be originated from this breach. And also there has to be resulting damages. So those four elements, when you look at it from this point, it's very simple, right? But it's not, because where the punitive damages comes into the picture, and this becomes a really big issue. Now, Anthony, what I was thinking is, and you've been working with me for the last 7 years, almost 8, and you know how we practice. We never ask anything personal from any of our state officials. Right now, with many of these officials, we now work together. Our interest is to bring them to our issues, make them understand our issues. Us as United Medical ACO, us being as private practices, which is getting more and more difficult. And this is one of the things that we can actually push with our senators and with our congresswoman. I think the replacement is going to be women as well. So with our other state officials to see if Delaware can actually get to the tort reform. So now we are going to discuss why this is important, but I'll let you say what you need to.
Yeah, I think just to add to the point you made earlier about 17,000 malpractice lawsuits are filed in the United States every year. And when you put that against the number of physicians in the United States, which is close to 1 million, I think, then your first thought is that, oh, this is not a lot, right? 17,000 every year. But then this number is almost a constant in the sense that it happens year over year. And when you project that forwards to 10 years, the picture begins to look drastically different. And that's where the real major issues come into play, right? The generally those lawsuits come in certain categories. There's the one coming from delayed diagnosis, for instance, or the failure to properly diagnose, right? Then there's the lawsuits that emanate from devices, treatment devices malfunctioning, for instance, or from adverse outcomes, or from delay in timely treatment. Those are some of the major categories that you see that come under these 17,000 lawsuits, right? And the real challenge comes from the impact of these lawsuits in the overall practice of medicine, and which is where the issue of defensive medicine comes into play. Defensive medicine being doctors practicing in a manner to defend against the potential of a malpractice lawsuit, which in turn comes with other implications to it of increased costs, overall costs to the healthcare system, overall cost to the patient itself, overall cost to health systems, and so on and so forth. And the impact goes on to bleed into the premiums that individuals pay on their health insurance benefits. And so while a malpractice lawsuit, whether it succeeds or does not succeed from the strictly legal perspective, it has a lot more impact across the healthcare system than merely paying damages for a successful lawsuit. And that's really where the challenge lies.
That's one of the most important part of this, right? So the cost of healthcare, but the cost in different ways. So like in one is like the defensive medicine. So it's increasing the cost of care by provider being extremely kind of like cautious about what may be happening. So someone who may not need an MRI is going to get an MRI because like you shouldn't be getting an MRI unless you have fever. But if something is happening that's outside of the possibilities, and then because just in case 1 in 10,000, so that just because you didn't do the MRI, it can be related to that. So now you are responsible. So then what's happening? They order a lot of studies, a lot of tests. And this is coming back to us every year. We do the prediction of the healthcare cost. Insurance companies are increasing the premiums, and someone is paying for that.
Yes.
And that's maybe your employer, but in many cases, it comes back to us because as it's getting more costlier, then we have to contribute, we have to do more, or we have to get lower plans, like lower coverage plans. So this is affecting the cost from that point, right? So the other thing that malpractice itself is so costly. You may remember in the early 2000s, OBGYNs for the OB side of the practice, they were not able to practice OB just because the insurance would be $250,000 to $300,000 a year. Yeah. And many practitioners, many OBGYNs stopped the OB part and then just practiced GYN because they couldn't afford the insurance anymore. Yeah. So now we always talk about access to care issue. Now you talk about the access to care when you don't have enough providers, especially on the OBGYN side. So, right, so this cost is not just one element of it. It has several different costs in several different dimensions.
Exactly. And it even does impact the decisions that medical residents make on the areas of specialization, because look at some of these challenges of practicing in a particular specialty. and making the decision that the overhead in this direction, in this specialty, is much higher, and that's resulting from the insurances, the coverages that they have to have in place in order to protect against these lawsuits. And the 17,000 that we talk about here, that also doesn't factor into the lawsuits that don't get anywhere after being filed, right? But costs are already incurred in order to respond to some of those lawsuits that at the end of the day are
the
deemed to
legal
be
system is always so close to the enemy, even without, like, not just for the medical side of it, but any type of defense. Like, you don't have to be at fault to be involved with some legal case.
Exactly.
Remember, in one of our cases, we spent just a little over 300,000 just for the legal fees.
Yeah.
Why? Because the other side wanted to spend money. Now, either you have to settle or you have to fight, and then we end up fighting just because we didn't have anything to settle for. And then this is a big part of it. But I think I'm more also worried about we give the example of OBGYNs. This is also true for surgery. It's extremely costly for surgeons. Yeah. So now it used to be just a specialist, but it's getting to the point of even for primary care is now being affected by this. And when these burdens are we are adding more to this, the practicing medicine, when we don't have enough physicians. We don't, like, now we have nurse practitioners helping us, physician assistants are helping us. We give more jurisdictions for them, like every year they can do more because there's no physician, there isn't enough physician in the system. So if you live different parts of Delaware, and if you go to South, the access to those primary care specialists is way different than North. So, like, we can't just look at it like, well, in Wilmington, I don't have these problems. That's not true, because in the state of Delaware, Kent and Sussex counties are part of the J1 visa program because of this issue.
Yes.
Because to care, because there are not enough providers. So now your significant other is becoming a doctor, or is it this year or next year?
Next year.
She's a doctor, but she's becoming a doctor again, right? So she's reporting.
Yes, she's part of the residency program at Bayhealth, yes.
She's going to be one of the first in Bayhealth program.
The inaugural class, yes.
Congratulations. So what's her take on this? Do you guys talk?
Not really, in the sense that her focus is often not on the business side of medicine, but rather mostly on the clinical side. Yeah, so.
All right. So now the other thing is that, when what providers can do to protect themselves, that's also important, right? So because, well, what I'm proposing for United Medical to do is, let's start fighting on this. For United Medical to lead the tort reform in Delaware as one of our goals, to help our private physicians, private practices. Because I know at the end of the day, it's not just going to protect the providers, but it's going to also protect the patients. So that's definitely the case. But one of the things, in the meantime, what providers can do is focus on their documentation. Like, as you know, in our system, we are doing different, we have one domain, we have shared domain. Multiple practices have the same EMR in the same domain. So what's happening with that is we can see how other providers are documenting in the network, different specialties, their staff, what they put in the chart. So I think, I know from United Medical ACO point, we have educational series for our employees and the network providers, But this is one part that they can improve by focusing on documentation, timely documentation. Those are important, right?
Yes, absolutely. Because the critical factor in it really is documentation. Because ultimately, if and when a malpractice lawsuit is filed, it inevitably goes down to, for instance, if there's an issue of adverse outcome, for instance, if that's a basis for a lawsuit, one of the key issues is what was the standard of care? Is it evidence-based? Is it based on standard guidelines? And all these captured in the process of documentation by the physician. So that becomes by itself critical. And a lot of this has been considerably helped by the advent of EMRs. But it then comes down to efficient use of the electronic medical record systems. And that by itself is as much of a defense as anything that the physician might have in the event that a lawsuit does happen. So that's the standard starting point in this.
I think from the tort reform standpoint, one of the other benefits is by reducing the number of total cases, you are also helping for those who are not able to access to the justice or timely access to the justice, right? So because there are so many cases out there, so then some of them are really bogus cases that shouldn't be, just because they can go after the punitive damages. I think it's encouraging people to go after every case. No one wants to take ownership.
The other side of it, speaking to the whole idea of tort reform, will be to look at options for raising the standard for what eventually qualifies for as a case to be adjudicated upon. If the standards are raised, and if there are, in addition, mechanisms that are introduced that may not necessarily result in every case in punitive damages, right? Then it would go some ways in reducing the overall number of malpractice lawsuits, and through that process, has reduced the impact of these on insurance coverages and so on and so forth. So there are different areas, creative areas that can be developed as part of overall tort reform, while still leaving enough room, remedy for patients who are truly harmed as a result of, say, negligence on the part of a physician. Right.
Yes, yeah, definitely. So one of the things that our people who are watching us, they already know, we bring so many different state officials. That's actually since the pandemic. That was one of our thing was, can we actually bring certain issues to their attention? So the prior authorization issue was one that we discussed. The primary care reform was another one that we understand the issues with the bill and how we can actually improve. And I know that we'll be able to get some positive results for that. But I think the tort reform is one that we've never discussed. And when I was in a conference last week with Dr. Erkan, one of the issues that was discussed was the malpractice and how the tort reform actually can help because all surgeons, that's the other thing. So when you look at the whole system, like patients, when they don't take any ownership, right? Like you give discharge instructions, they don't read. So we have to get signatures and then we scan it in the chart. You have to have other people, family members helping them. Then in some cases, family members are not helping or they don't want to understand what's happening. And then when there's a complication, the first thing that they want to do is blame the physician who's taking care of them, but they didn't do anything to understand what was happening with that patient. So just because the malpractice rewards can be so high, now everyone is looking at different ways to see how we can find the doctors that fall. And that's fundamental problem is that, so where it's not proportionate. So you can be rewarded for like $5 million for something that has no relevance or not even significant in some cases. So that's where the imbalance is. So that we need to really work on. And I believe our Lieutenant Governor is going to join us in the next couple of months. Matt Myers is confirmed in, I believe, next week or the week after. I may be wrong with the dates, but in the next 3-4 weeks, he's going to be here. So I want to ask them what their position is and how they can actually help. Remember that meeting yesterday, and I don't have to name the insurance company, but it's same as our company, except they go with healthcare, we go with medical, right? So the smart ones will, the ones who are paying attention will know which one I'm talking about. The medical director, when those compliments were coming from him, it was humbling at one point at a certain level. But the other thing is that, well, when we are doing this good of a job, what do you do for us? The insurance company, right?
Yes.
Nothing. We have to fight for everything. We have to just like get the standard fee schedule. And if we didn't put that fight out there, it wasn't going to happen. But then I know that I appreciate for him to acknowledge how great we were, but there isn't any reward for those who are way beyond what the system actually requires or what the standard norm is in medical society or medical community. So, but I still want us to fight on those issues to see if we can make some impact and then make the private practices' lives easier where their longevity can be protected. Hopefully, that's kind of like one of my business personal goals. So last week we started talking about affirmative action. So I had Sean with me, and he and I, we were a little bit different on it. Usually we are on the same page, but on that issue we were kind of different, and then he brought a different perspective to that. You and I, we didn't talk about this. But I want to actually get your take on now. Your education, your main education was done in Nigeria. Your wife is a doctor. She was a doctor in Nigeria, so you are well educated even before you come to this country. But I think you and I, we may have a good advantage of maybe comparing what we have here versus what we have in different other countries. Now, I'm also kind of interested in your perspective on this because you have 2 kids. They're in middle school or high school. They're in between, right?
One in high school, one's going to middle school.
I was right.
Yeah, you're right.
So then this may have different impact, or you may actually have a different take on this. So I'm kind of curious what you think of that.
One of the things I do when issues of this nature that are highly controversial break when issues like this occur is that I listen to it, then I try to take a step back, right, and look at it again. And a couple of months ago, I happened to attend an event in my son's school, which was a meeting with admissions officers, college admissions officers, and they made presentations. And one of the things that stayed on my mind, especially when this decision was made by the Supreme Court was that how they classified colleges. They're the selective colleges, and then the unselective colleges. Of the total number of student admissions versus applications, right? The selective colleges typically admit about 6%, 6 to 8% of all college applications. So the Harvards, which was part of this lawsuit, I think UNC, and then other Ivy League colleges like Princeton, they have.
So the main one was Harvard and University of North Carolina.
Yes, and they have admission acceptance rates of about 6%, 5%, I think, for Yale in 2021 or 22, I think. Now compare that to University of Delaware, which is at 74%, right? 70 to 80% of all college applicants, successful applicants, go into these schools that are not the selective colleges. So University of Delaware accepts 75% of all applications. Now, I imagine that Wilmington University will be something in that range too, 70-something percent. I think the University of...
regardless of their race, right?
Regardless of race, yes. So...
And now University of Delaware is in the top 75 in the United States.
Yes.
That's
yes.
I mean, I'm not considered 75, but yes. their ranking is really good.
Yeah.
So one of the best colleges, the best universities.
One of the best, yes. So it's important that we always put some of these issues in proper perspective. The idea of affirmative action was a really worthy and noble decision made back in the day in order to drive access to high quality education in the minority communities. But in the year 2023, the vast majority of African American and Hispanic college applicants are going in the direction of the non-selective colleges, like University of Delaware, like University of, I think, Westchester, which has about 80-something%, right? Wilmington University, and so on and so forth. And you have them all over the country. And it seems to me that while this ruling was significant, I'm more concerned about the domino effects in terms of how this ruling is interpreted, for instance, in the issue of minority scholarships, for instance, and how does this affect perhaps selective funding of historically Black colleges and universities?
So that actually, Sean brought that up last week, and he asked me what my position on that one is. But are you saying that they should be doing what they're able to do as of today, or should they also?
I'm saying that this ruling, right, is important in more ways than is immediately obvious, right? It's important, I think, in the sense that it should push attention in the direction of how do we enhance the ability of these non-selective colleges and universities to provide more affordable college education, right? To the 70-80% of African American and Hispanic applicants who are going in this direction already, rather than the 2% or 6% of African American applicants who are going in the direction of the Ivy League colleges, and therefore subject to the adverse impact of this ruling. Adverse as it may be, it's only affecting about 2 to 6% of the African American and Hispanic population.
Mhm.
So I think that in its own way, the ruling can have a positive effect in the sense that it could be an opportunity to drive attention in the direction of the schools that actually matter to the vast majority of African American and Hispanic population. The plaintiffs in this lawsuit were obviously looking at the data, and they see that Asian students
Mhm.
make up 3 times the percentage of both minority and white applicants going into the Ivy League schools like Harvard. They make up about 3 times the number of people who are applying in those directions, right? And it's then possible to use that data to identify, to make the case. It becomes a predicate in making the case that there is reverse discrimination going on. That may or may not be true. That's debatable. But in any case, the Supreme Court sided with the plaintiffs. But still, it doesn't change the fact that 70–80% of those applications are going into schools that are accepting 80%, in some cases, 89% of all applications. And that's where I think that the focus should be.
So then why are they, why do you think they are spending this much energy on this? Like, is there maybe a different message that this is gonna, like, maybe you're right. So this may carry out to the other issues. And although it's not a significant problem overall, but now it's almost like the, I don't want to talk about it, but like it just keeps coming. It's almost like the transgender issues. How Leah Thomas became the main focus.
Yeah.
And many transgenders were not really happy with that.
Yes.
Because what she did, or he did, was wrong, right? And then now it's just bringing this issue to a different level. So this is almost like this, like maybe like I'm thinking maybe similar. So this may actually have more impact on minorities if the reverse discrimination starts. Is that what you're saying?
What I'm saying is that it should motivate action, but in the direction of the schools that actually have the potential to deliver the greatest impact in those minority populations. That's where, if there is any reaction, if there's any new approach to this, in 2023, essentially saying that the focus of affirmative action needs to be better channeled in the direction where it can have the most impact, right? And that it's important that it preserve some of those related policies, for instance, dealing with minority scholarships, which might be impacted. I think I was reading some report about letters going out to certain schools inquiring about the minority scholarships, for instance, right? Then there was, I think, about last year, there was some funding, some major funding coming from the Biden administration for HBCUs, for instance, right? And such policies, I think, have much more impact than strictly speaking, affirmative action being retained at Harvard University, because the numbers,
I follow what you're saying.
It's very small.
So you can actually do a lot more where maybe it's already happening, but it's not getting enough attention.
It's not getting enough attention, but more can be done at the same time.
Why do I have to remember Leah Thomas's name? Like, why did I memorize that name? It's because the attention is right there.
Yes, because the attention is there. Yes.
They're making this issue as like, well, this is what these colleges are not going to be able to do. But overall, maybe it wasn't really that important because it was not impacting that many people, right?
Yes, it was not impacting that many people because the dynamics in 2023 is totally different from what it was, say, in 1964, as the case may be, right? And the driving factors behind the decisions that students make in what colleges to go to, oftentimes different these days. They are more often than not proximity to home, right? And my wife would prefer that our son goes to a college that's nearby, for instance, all right? And we can multiply that in many different directions, parents wanting their kids to be a little bit closer to home. So those are some of the driving factors. And then that often means the non-selective colleges, more often than not, that's what it means. It means the University of Delaware, for instance. It means Drexel, St. John's in New York. Those are the schools that are absorbing, like I said, about 70-something% of the applicants, right? So, and for them, the application of the impact of affirmative action in the admission process is not as acute as it is, for instance, when you put that side by side with what's going on at Harvard University, because it's a selective school in the first place, whereas UD is not a selective school, it's a non-selective school. So that's why I started out by saying that when issues like this come up, I listen to it, and then I step away from it a little bit, and I try to educate myself at a broader level.
I think sometimes the message that it's giving, not necessarily impact, but just like the Supreme Court is the highest court, right?
Yes.
So I think the reason maybe it's getting this attention is because it's also giving a message. Like, maybe that's what people are worried about. I personally, I can tell you, I do believe that, unfortunately, still racism is there. I do also believe that protection is needed. Some oversight is needed. I'm not saying that you need to give everyone everything that they can't have, but that there is in this system, in this country, in other countries, they have their own racism issue. Like what's happening in France right now it started with one Algerian guy being killed, 17-year-old, and that's their racism, right? So and because it's there, I still believe that there is some legal oversight on these issues is important.
Yes.
So
it is very important because when we relate that to healthcare, for instance, right? Mm-hmm. It takes an additional dimension because there are health equity issues that are at play here, and we need greater diversity in the healthcare workforce in order to be able to address some of these issues. Right.
There is an issue, right? So that's a really important point you brought up. So what's happening in healthcare with the social determinant of health? Yes. The main reason it's there is because we know that minorities not getting what they should be getting, not because it's not available to them.
Yes.
Sometimes they are not aware of that, or they have other struggles in life that's actually taking over priority. So then they cannot really just go for routine colonoscopy or routine annual physical and like those types of stuff. So that's why I was saying that this is still in the system, and then we can probably see this in a really good way because we are in healthcare. So we know that society, the community that we live in, still has this problem. So that's why I kind of like the idea of what affirmative action was doing. So just if it wasn't going to impact too many of them, why would we cancel it? Right. So that's what the issue maybe.
Yeah. That's one of the that I suspect is part of the reaction that you're getting from this ruling. I recall a speech by the late General Powell at the Republican convention going back at the time George Bush Jr. was running the first time. And he actually addressed this issue in terms of the need for the United States to live up to that promise that's embodied in affirmative action. So the issue, the core part of this, and what essentially I'm saying is how do you direct this in a manner that achieves the maximum impact, right? Yeah. And applying it in the way it was done at the very beginning, at the time that African Americans were coming out of the Emancipation Proclamation and all that, right? Applying it in that same manner, I think that it's long overdue, really, for a rethink in terms of how you apply it, not the policy itself, but the application in the year 2023, and recognizing where students are coming from and what's driving the decisions they make, and in what direction those decisions are going. Really, that's probably the most important part of what I see from this ruling.
True. So my position is the society that we live in, like let's say 70% white, 20% black, 10% others. So that needs to reflect in everywhere that we are, for our kids to be better prepared, what they need to, where they need to live in, how they need to live. Because this starts from school. So, and it's not just the college, but all the way to the kindergarten level, so that they have these schools should reflect the society that we live in. So, and if it requires some protection, I don't see any harm. But more protection usually brings harm in the long term.
Yeah, the other thing to point out is that even within the ruling itself, right, there's some creativity that will be required of admissions officers, even in all the schools, including Harvard, in terms of how, for instance, they implement an aspect of the ruling that's asking about the lived experience of the college applicant, right? Because that gives, that potentially creates an opening for an applicant to, through the essay that they submit, for instance, to relate their life experience, and through that process, perhaps bring in an aspect of race and how it defines them as an individual, and how it defines their lived experience, and how that lived experience can enrich the college education that they'll potentially receive.
Absolutely. No, that's very very true. So hopefully it will be it won't create any unnecessary trouble. And it will maybe what you were saying earlier, maybe it will have a different positive impact in different ways. Hopefully that's it. So, well, Anthony, thank you. So earlier I was saying Matt Myers, who was confirmed he's 8'4", and then I believe Colleen Davis is, if I'm not mistaken, she's going to be in she's going to be maybe in July. So there's a couple of people in July, but I can't see them. Maybe Sean can update them. So then,
has she already announced?
I believe so. If she didn't, I did it for her. So like, I know that she's running. So or she will run, but well, more people is better. So
more people.
It's going to be an interesting term for everyone. Interesting time. Well, again, Anthony, I know this was kind of last minute, and thank you for joining. And I think it's a good conversation. And then again, we take these every topic that we discuss. They're related to what we do for our physician offices, for our employees, and the community that we live in. So that's why some of these discussions start here, and then we take them and then follow up with them and make it happen. So thank you, and we'll be back with the Bariatric Friday. Dr. Erkan will join me in 10 minutes, and we'll see you guys next week. Thanks.
Thanks for having me.